It's day 127 and the mail is here. So let's dig in. Our first alert today for you. Dear Eric, I'm on all different types of medication. I need to lose about 50 pounds. And my question is it possible to lose weight while I am on this medication? My doctor says that I can't go off of medication, but I know that I'm gonna feel better. If I could lose this extra weight, what should I do? Sincerely, Rose. I'm glad you wrote to me, Rose, because this really is a very serious question. I know there are a lot of people out there who are probably wondering the exact same thing, but we're afraid to ask. First, let me start off by saying that no matter how many pounds you want to lose, never ever stop taking medications without consulting your doctor first. People take medication for all types of reasons. Whether they have high blood pressure, or they need medication for their heart, or some other condition. No matter what the ailment, if your doctor has prescribed medication for you, you should follow his or her instructions completely. This is a must. Now, the answer to your question about whether or not you could lose weight while taking medication is yes, you can. But I have to be honest with you. Sometimes it's hard to lose weight when we're on medication. That's because some medication may cause you to retain water itself. So you may not lose weight as quickly. But please, Rose, don't be discouraged. Even though it may take a little longer, you still will lose the weight. I said it might be harder, but I didn't say it was impossible. The important thing to remember is that you stay on the recommended level to the average rank you want to do. Don't try to skip meals or lower your caloric intake just because you don't think you're losing weight fast enough. But before you do anything, I want you to see your doctor and go over your meal program completely. I want your doctor to be fully aware of your weight loss program so that he can monitor your progress under medical supervision. I know you'll lose this weight that you want to lose, Rose, so just be patient and don't be depressed if things aren't happening as quickly as you like them to go. But the important thing is to be sure you're following your doctor's orders, okay? Let me know how you're doing. And now here's another letter. It's from Paula. And she has a very interesting question. Dear Eric, I have high blood pressure, and I recently read somewhere that eating bananas can lower your blood pressure. It is really true. None of the bananas have a lot of natural sugar in them. So I want to put weight on if I eat a lot of bananas. Please let me know what to do. Thanks. Well, Paula, let me clear up a few things for you in this topic. First of all, bananas are very high in potassium, which is an important nutrient you need every day to help keep your blood pressure down. If you have low levels of potassium, then your chances of developing high blood pressure are greater. And people who already have high blood pressure could make their condition worse by not getting enough potassium. So while eating bananas may not actually lower your blood pressure, it does help you to keep it from getting worse. And for people who have normal blood pressure, if you reduce your potassium intake, you can increase your chances of high blood pressure and the stroke. So I don't want you to race out to your local store and buy every last bunch of bananas on the shelves, but you should try to eat more bananas during the week. Cut them up and put them in your cereal, or have them as a snack. There are other great sources of potassium too, like dried apricots, or you can consider about the sugar in your banana if you like. Potatoes and broccoli can put potassium in your daily food program without adding a lot of calories. But please remember, bananas are not a substitute for your blood pressure medication. You should always follow your doctor's recommendation. So don't let anyone make a monkey out of you, Paula. Eating bananas makes a bunch of sense. Now remember, if you have a question, write them down and send them to me, and I promise we'll get you a good answer.